All right, I want to welcome all of you that joined me tonight, and welcome many of you that are listening to the playback. Just to introduce myself, my name is Sonia Eames, and most of you know me, but I am a certified health coach for a company called Take Shape for Life, and my certification is through the Center for Obesity Prevention Education through Villanova University. And I'm going to go ahead and share my screen with you guys so we can go through this and get started here. All right, let me change this slide here. All right, okay, we are set. So like I said, my certification is through the College of Nursing through Villanova University. And just to let you guys know kind of my story, I am someone who basically, I feel like I've struggled with my weight and my health a good portion of my life. I've tried so many things out there, and I would lose weight and then I would gain it back plus some. And I really was just at a point last summer where I was at my heaviest weight ever. And I just wasn't happy. I knew that it was affecting the kind of mom that I was, the kind of wife that I was, and really just my everyday life. I just felt like I was living on the sidelines of my own life. And but at the same time, I just felt hopeless. I felt discouraged because I had tried everything and I'd failed. And so I kept telling myself, I've just got to learn to be happy this way. But at the same time, I couldn't figure out how to be happy. And so it was about that time that I got in contact with a good friend of mine from years ago. And she had this amazing before and after picture, and I knew her, I trusted her, I knew she wasn't going to do anything crazy. And so I reached out to her and I said, what are you doing? And, she started telling me about the program, and immediately I just felt hopeful. I felt like, you know what, I might be able to make this work. And so I got started. And since then, I'm actually pretty close, almost down 70 pounds. And the other great thing is, since then, my own family has kind of jumped on board. My husband, my mom, I have sister-in-laws, I have an aunt, and between all of them, and they have lost over 155 pounds combined. And that's just been a huge blessing in our life. And I'm just really grateful for what this plan has been able to do for my family and for what healthy eating has done. All right, so let's keep going, and I will tell you guys more about how this all works. First, I would like to address the health crisis in America. The Centers for Disease Control started keeping statistics in 1985. And by 1995, all the states in the United States had stats. And you can see by these blue colors here, it's somewhere in the 10 to 19% range of obesity for the nation. But if you fast forward several years to 2010, you'll find that most of the country is in the orange color, which is 25 to 30% or more in those states. And here's some more USA Health stats. 2 out of every 3 adults in our country are overweight, and 1 out of 3 of those adults are obese. And the startling fact is that 1 out of every 5 children are now facing obesity. And those are kids, we're talking about kids ages 2 to 19. And another fact is that, that number has changed. It used to be ages 10 to 19, and just recently they had to change it down to 2 to 19, which is just a really sad statistic. 25 million Americans have diabetes, and 79 million Americans are pre-diabetic and may not even know it yet. So the question is this really evolution? And of course not. So at this point, I really want you guys to think about what your health goals are. Maybe you have a goal to just eat healthier, or to increase your physical activity. Maybe you want to reduce stress in your life, or you want to sleep better. These are all things that affect our health. And it's important to think, if you could do anything physically or have all the energy in the world, what is it that you would want to do? Do you want to run races? Do you want to be able to play with your kids or travel or hike? Do you want to go bike riding? Or, do you just want to be able to go up and down the flight of stairs and not feel out of breath? And another really important fact is who will benefit from you getting healthy. It took time. It took months of me being on program before all my family kind of said, hey, I want in on this. But, I know they benefited health-wise, but I also know that my family, my immediate family benefited just because I got my self-confidence back, and it's made me a better mom and a better wife. And what we find is that, improving our health is contagious, and it's a good thing to be contagious. If we're making healthy choices, it really starts to affect the people around you. And so, if we could choose to have optimal health, would we choose it? So let's talk about some different matters of health. I want to give you guys some really good tips that you can start implementing right away in your life. One of them is that when you wake up, you want to eat within the first 30 minutes. And a lot of people don't realize this. They may think, I'm not hungry when I wake up, or I don't eat breakfast. But what they don't know is that jump-starting your metabolism is so important. And eating within a half an hour of waking up basically sends a signal to your brain and your body to stop storing fat. It helps us get our metabolism going. And then after that, eating every 2 to 3 hours after we wake up helps to fuel our body properly and keep our blood sugars balanced and keep our metabolism burning strong throughout the day. And, this is a concept that is important not only for weight loss, but also for weight management and for balancing our blood sugars. It's something that everyone needs to do regardless of where they are with their weight. So what are we supposed to eat every 2 to 3 hours? What we want to eat is we want to eat small, balanced, carb protein meals 5 to 6 times a day. And probably a lot of you have heard that before, that eating 5 to 6 times a day is the healthiest way to eat. And I'm going to talk about that a little bit more in a little bit. But the next thing I wanted to talk about is the importance of drinking water. And we recommend, and I tell all my clients, that they need to drink half of their weight in water. So in ounces, not half of your actual weight. So here's an example. If you weigh 200 pounds, you're going to want to drink 100 ounces of water a day. And it's just a really good rule of thumb. And I always tell people, of course, don't be drinking your calories like sodas and juices, but just, get your water in. It's going to be so much better for your health. Okay, so let's talk about why time matters and, why we should eat 5 to 6 times a day. And this honestly is one of my favorite things that spoke to me when I was starting this program. There was a clinical study that was done by David Jenkins at the University of Toronto, and it was done on low glycemic eating. And what he did was he took 2 groups of people, and they ate the same number of food calories, and they ate the same foods. And that's really important. Like, they ate the exact same food. One group ate it 3 times a day, and the other group ate 6 small meals a day. And the group that ate the 6 small meals a day lost more weight. They were less hungry. They reduced their cholesterol by 15%, and they reduced their blood insulin by 28%. And this is why it's so important that when you eat during the day. The chart shows what happens when you eat low glycemic fuelings 5 to 6 times throughout the day. Those meals are only going to spike the blood glucose and insulin right around your baseline. And it's important to do this for your health. If you are eating 3 high glycemic meals a day, you would experience a huge blood glucose spike every time you eat. Or basically, you eat that sugar and a couple hours later you're tired and you feel the need to go grab something else. But what happens is your body's having to pump that insulin to combat it and bring it back down towards the baseline. And it's just not a healthy cycle. It's what leads to diabetes. And we really need to try and pay attention to keeping our blood sugars steady and even along that baseline. Excuse me. So basically, what I'm trying to tell you guys is that combinations matter. We talked about eating 5 to 6 times a day, protein carb balanced, and a lot of people think they have to get their protein from chicken or meat 5 to 6 times a day, and who wants to do that? So it's important to note that protein comes from so many sources. And so here's some examples for you guys. You've got eggs, Greek yogurt, low-fat cheese, nuts, obvious, the fish, poultry, and meats, and then cottage cheese, beans, and some people use protein mixes, and that's fine also. And they're all great protein sources that you can use throughout the day. And a lot of times, same thing, when people hear carbohydrates, they think of bread or rice, but carbohydrates can come from a lot of healthy choices like fruits and berries and vegetables, low-carb tortillas, whole wheat toast, high-fiber crackers, steel-cut oats, quinoa. There are a lot of different things that you can use for your carbs. So fruits and vegetables won't spike your blood sugar as much as things like bread. So your combination matters, and Each time you eat throughout the day, choose a protein and choose a carb and pair them for every meal. And one thing I'm a big believer in is portion controlled meal replacements. The ones that we use with Take Shape for Life are already balanced for you. They have the proper amount of protein and carbs, and they're such an easy option for healthy fueling. And another thing is stop letting that food have that power over you. I like to think that every time I'm eating, I'm fueling my body. And it doesn't have to be for the taste of the food. It doesn't have to be for the emotional fulfillment. Granted, I love food. It's one of the reasons I ended up in the situation I was in. But I'm learning to love different foods. And I'm learning to love foods at certain times. And at other times, just look at that food as fueling my body so that my body can do what it needs to do. So your plate matters. So let's talk about a really great concept that helps people stay within healthy parameters. And we call this the 9-inch plate in Take Shape for Life. As you can see, half of your plate should be filled with your fruits and your vegetables. 1/4 would be protein and 1/4 would be your starches. And this is just a really good visual. A 9-inch plate is obviously much smaller than the plates you're probably going to see at a restaurant. Those are usually about 12 to 14 inches. But, this is just an example of what your plate could look like with the list there, the chicken, the asparagus, the spinach, cherry tomatoes, Italian dressing, brown rice, all of that food for 438 calories. And here's an interesting fact about restaurant portions. Most Americans going out to eat would have 2 cups of brown rice. And they'd probably feel like they were being pretty healthy because they ordered brown rice instead of white rice. But just that 2 cups would be more calories than this entire meal. So right there, you're doubling your calories. And, who wants to do that? All right, we're going to talk a little bit about the glycemic charts. And just so you guys know, I will send out these slides to anyone that is interested or sends me a message, or anyone who was on also. So don't worry about having to take notes. But basically, sugar matters within each group. You take your fruits, for example. We talk about a glycemic index where 100 is pure sugar. And we talked earlier about how your body responds to pure sugar. You eat it, your blood sugar goes sky high, and then your body has to pump in the insulin. So it's much better to more often choose foods that are lower on the charts. And some of the good low glycemic choices are berries, apples, nectarines, and peaches. And some of the higher ones are pineapples or mangoes. And now one question I get from my clients is, you mean I can never eat pineapple again? And no, of course not. You can eat pineapple again someday, or if you're healthy right now, you can eat it right now. But, make better choices with it. Put it in a fruit salad so that you'll have less of it in one sitting, or pair it with a protein, and just make sure you're doing that carb protein balance. So then going on to the vegetables, and this one's really interesting to me, and I want to point out because this was something that I just learned recently. But I want to talk about carrots, because carrots are found in both the high and the low glycemic. And when they're raw, they're a 30. But a cooked carrot is an 80. And I always like to point out that cooking a food can change the composition of the food. So eat vegetables that are both raw and cooked. Okay, support matters. This is one of the things that made the biggest difference for me in my weight loss journey and my journey towards health. Here at Take Shape for Life, we are really serious about support. We want to make sure that everyone feels supported in their journey, whether it's weight loss or just eating healthier. I have clients that range from wanting to lose a lot of weight to clients that don't need to lose any weight, but just want to make healthier choices. So obviously we have the personal health coaches. We also offer Facebook groups that are amazing, nutritionist and dietitian support, doctor and nurse support calls, weekly client support calls. Basically, we want to make sure everyone is supported on their journey. And we just offer a large range of things so people can find what works best for them. And also education matters. And, we might know people, you probably all do because you all know me. You all know people that have lost all their weight and then have gained it back. And we really want our clients to have the proper education to know how to create long-term health goals. I always knew this was huge for me. I knew that I could follow a diet and lose weight because I had done it before, but I would gain it back. And really, it's more about rewiring our brains. It's about changing how we think about food, recognizing those triggers and knowing how to respond to them. And so our curriculum focuses not on just learning about food or exercise, but how to deal with those triggers and how to make better choices and create better habits that then over the long term are going to help you reach optimal health. And I always try and tell my clients that, reaching a number on the scale is just a side effect of becoming a healthy person. And when you reach that number on the scale, it doesn't end there. We're still going to be setting goals. We're still going to be working towards optimal health. Okay, a simple, safe program matters. No matter if you are wanting to lose weight or learn to eat healthier, it is important to find a program that is going to help you get there in a healthy way. And I say that from experience because I have done it the unhealthy way, and this is so much better. So you want to find a way that's going to protect your lean muscle, that's going to give you the proper nutrition and vitamins that your body needs. So ask yourself, do you currently eat 6 small protein balanced, carb protein balanced meals a day? Have you tried to make changes on your own and fail? Are you getting the proper nutrition? And, do you need help? If the answer to that is yes, I would love to tell you a little bit more about Take Shape for Life and how I did it. So basically, we have our clients start by practicing with 1 meal a day. And this is the whole concept with the protein and carbs together. So 5 to 7 ounces of lean protein, chicken or fish, or other examples I mentioned earlier, and 3 servings of non-starchy vegetables. And it's good for general health to have the bulk of your healthy vegetables to come from the more non-starchy items like salad and tomatoes and green beans. And there are lots of good non-starchy choices. And simple nutrition is really important. One of the biggest reasons why people find it hard to get in 5 to 6 small meals a day is because we're too busy and we're always on the go. And this is why fast food is having so much success in America. We really want people to have easy, quick nutrition. And if you're wanting to lose weight, you will use 5 meal replacements a day. And if not, if you're just wanting to eat healthier, then it would be more like 2 to 3. And these are just a tool to help you get the weight off. They're not something that they're always available, but it's not like we're saying, let's eat this way, 5 to 6 of these the rest of our life. But they're quick, they're healthy, they're grab and go meals, and they're the perfect balance of protein and carbs that will balance to naturally burn your fat and protect your lean muscle. And there's tons of different examples. I think they have like 70 to choose from, from bars to shakes to soft serve ice cream to, soups and macaroni and cheese. There's tons of them. And, my whole family loves them. But, everyone finds things they like, and it's good to have quick, easy, healthy options. So our parent company is Medifast, and they have been a leader in safe, effective weight loss for over 30 years. We've been recommended by 20,000 doctors since 1980, and all of our research is done at Johns Hopkins. So you really know it's safe, and it's effective, and it has all the medical research to back it up. And one other thing that is great is that we're an American company. We own our own research and development, manufacturing, and warehousing right here in the USA. So the standards are high, and it's not food flown in from another country. Okay, I just want to give you guys a couple of examples of friends and clients who've done well with Take Shape for Life. Up at the top is Deborah, and she's currently a fellow coach, who lost over 75 pounds. And, since her after picture, she's even had a couple kids and is keeping her weight off. And, below her is Dr. Pecoraro, and there's a lot of doctors that have done this plan. There's a lot of doctors that recommend it, but there's also doctors who needed help and have used this plan to get healthy. And then Molly and Carl down in the bottom. One of the most rewarding things probably is coaching couples together. I know I enjoyed this program, but when my husband started doing it with me, not only was it easier, but it was just great to be able to support each other. And so it's, who doesn't love seeing a couple get healthy together? Basically, going back, there are a lot of examples of people who found success on the program. But just so you guys know, Take Shape for Life isn't just about weight loss. It's really about optimal health program. And we want people not just to lose weight, but to be able to reach their goals, whatever those goals might be. So you might say, hey, I'm ready for my healthy eating makeover. So what's next? Or you need help with weight loss. 2/3 of the country does, so you're not alone. So if that's the case, then go ahead and let me know. Call me, text me, email me. My phone number, 256-542-7392. my email is soniakaeames@gmail.com, and my websites are listed also for the program. But if this is something that you feel like you either want more information on or you're ready to do this, I know I was back September, and it was one of the best decisions I made. And we'll get your order placed, we'll get your education materials, your meal replacements. All the coaching is free, all the support is free, and that would be me. And I'm fun, so what could be better than that? And it's also important to kind of take a moment and think about who else needs help. I didn't become a coach to make lots of money. I became a coach to keep myself accountable, and I became a coach because I found something I was passionate about. I was passionate about what this program had done for my life, and knowing that if I could help anyone else out there not feel the way I felt last summer, that I wanted to do that. And so if there's anyone that we really need to open our mouths and talk to people. We know about getting healthy. We all know people that would benefit from a healthier life, or those whose lives could be saved from gaining their health back. So if you found this webinar helpful, pass it on to someone that might benefit from it. Also, we're always looking for new health coaches, people that are passionate about health, to help our cause of getting America healthy. So if you know someone, or someone that and that was the same thing. If you or someone might be interested in helping others, feel free to contact me also. So other than that, check out the website. And thank you guys so much there I am again. Thanks so much for joining me tonight. And, let me know if you need any help, and if you have any questions. Otherwise, thanks guys. Take care.